Let me ask you something that might make you a little uncomfortable. Do you remember the last time you woke up feeling like you actually slept? Not just lying in bed for 8 hours. I mean the kind of sleep where you open your eyes and you feel ready. Ready for the day. Ready for your family. Ready to take on whatever comes your way. If you have to think about that for more than a few seconds, I need you to pay very close attention to what I'm about to tell you. Because there is a silent thief inside your body right now. It does not make a sound. It does not cause any pain. It does not show up on the standard blood test that your doctor runs at your yearly physical. And yet, it is slowly, quietly, and systematically destroying your blood vessels, your heart, your eyes, your kidneys, and your energy. I am talking about prediabetes. Now here is the part that stopped me cold when I first started looking into the data. Nearly 100 million Americans have prediabetes right now. And a staggering 80% of them have absolutely no idea. That is not a typo. 80%. That means if you are sitting in a room with 4 of your friends, statistically one of you has this condition and does not know it. You could be that person. You could be sitting there right now, feeling fine, functioning, living your life, and your body could be one bad meal away from a cascade of damage that you will never see coming. And here is the real kicker. The test that most doctors use to screen for this condition is missing the diagnosis in over 50% of cases. That means you could walk out of your doctor's office with a clean bill of health while your body is silently destroying itself. My name is Dr. Williams, and today I am going to show you exactly how this happens. I am going to tell you the 3 warning signs that your body is sending you right now. I am going to reveal the one number that your doctor is probably not checking. And I am going to share a story about a patient named Robert that still haunts me to this day. By the end of this video, you are going to know exactly what to do to protect yourself and the people you love. And if you care about the years you have left, I need you to stay with me until the very end. Before we go further, if you find this valuable, please hit that like button right now. Subscribe to the channel and drop a comment below telling me where you are watching from. I love hearing from the men in this community, and I read every single comment. Now, let us get into it because what I am about to share with you could genuinely add years to your life. Let us start by tearing down the biggest lie that is keeping men sick and tired. Most people believe that prediabetes is just a sugar problem. They think it is about eating too many donuts or drinking too much soda. And because of that, they tell themselves, I do not have a sweet tooth. I am safe. But that is a dangerous lie. Prediabetes is not really about the sugar you eat today. It is about what your body is doing with that sugar inside your bloodstream. Think of it like this. When you eat a meal, your body breaks down carbohydrates into a simple sugar called glucose. That glucose enters your blood. Your pancreas, a small organ behind your stomach, releases a hormone called insulin. Think of insulin as a key. It unlocks your cells and lets the sugar inside so your cells can use it for energy. It is a beautiful, elegant system. But here is where the trouble starts. If you consistently eat more carbohydrates and sugar than your body needs, your cells start to get tired of listening to insulin. They become resistant to the key. So your pancreas, thinking it is not making enough keys, starts pumping out more and more insulin to force the sugar into the cells. This is like yelling louder at someone who is hard of hearing. It works for a while. It works for years, actually. Your blood sugar numbers on a standard test might look completely normal because your pancreas is working triple overtime to keep them down. You feel fine. Your doctor might even tell you that you are fine. But underneath the surface, your insulin levels are dangerously high, and your body is screaming for help that nobody is hearing. And that screaming is the damage. High insulin is the real enemy, not high blood sugar. This is the pre in prediabetes. It is the warning light that almost everyone ignores. And this is where the heart connection comes in. Most men have no idea that prediabetes is a heart disease in disguise. When you have too much sugar circulating in your blood, it starts to stick to things. Think of it like pouring syrup down the pipes in your home. At first, nothing happens. The water still flows. The pipes still work. But over time, that syrup starts to stick to the walls of the pipes. It builds up. It narrows the pipe. The water pressure goes up. One day that pipe bursts. That is a heart attack. That is a stroke. And you do not hear the pipes complaining. You just see the flood. That is exactly what happens inside your blood vessels. The sugar sticks to the walls of your arteries. It makes them stiff and inflamed. They lose their natural flexibility. Instead of being soft and resilient, they become rigid like old garden hoses that have been sitting in the sun for years. A stiff blood vessel cannot handle the pressure of blood flow the way it used to. Your heart has to pump harder. Your blood pressure rises. The tiny tears in your arterial walls become prime real estate for plaque buildup. This is the beginning of the hardening of the arteries that leads to heart attacks and strokes. By the time your blood sugar crosses the threshold into full diabetes, your risk of heart attack has already doubled or tripled. But here is the kicker. Even if your blood sugar is only slightly elevated, still in the prediabetes range, your risk of heart disease is already significantly higher. The damage starts early. It starts in the prediabetes zone. I have seen men in their 50s with flat stomachs, men who look the picture of health, come in with blocked arteries, caused by nothing more than years of unmanaged insulin resistance. They were lean on the outside but sick on the inside. And that brings me to the story I mentioned earlier. It is the story of Robert. Robert was 62 years old. He had just retired. He was fit. He walked 3 miles every single day. He ate well. He did everything right. He came in for a routine physical, just a checkup. His fasting blood sugar was 98. That is normal. His doctor looked at the number and told him he was fine. He was healthy. 6 months later, Robert had a massive heart attack while he was playing with his grandson in the backyard. He survived, but he lost a piece of his heart muscle that he will never get back. When we ran the full panel after his heart attack, we checked his fasting insulin. It was through the roof. He had been pre-diabetic for years, and nobody caught it because nobody checked the right number. Robert's story is not rare. It happens every single day in this country. Men are walking around with a ticking time bomb in their blood, and nobody is looking for the right trigger. And that is the enemy here. It is not your doctor. It is not you. It is a system that has been using the same outdated test for decades because it is cheap and easy. Your insurance covers it. It is quick, but it is not accurate. It is missing millions of cases. And while the system saves money on a cheap test, you pay the price with your health. You are being failed by a system that values cost over your life. I am not saying this to scare you. I am saying this because you deserve to know the truth. You deserve to know that there is a better test. There is a way to catch this thing early, and there is a way to reverse it completely. Now, let me tell you about the 3 warning signs that your body is sending you. Most doctors completely miss these because they do not ask the right questions. Number 1 is the sleep connection. If you are waking up in the middle of the night, especially between 2 and 4 in the morning, and you cannot get back to sleep, that is a huge red flag. Your blood sugar is crashing in the middle of the night because your insulin is out of balance. Your liver releases a stress hormone called cortisol to bring your sugar back up, and that cortisol jolts you awake. You think it is just stress or age. You think it is just part of getting older. But your body is literally waking you up to tell you that your sugar regulation system is broken, and that broken system is directly stressing your heart. Let me explain why this matters so much. When you do not sleep well, your body becomes even more resistant to insulin. One single night of sleeping only 4 hours is enough to reduce your insulin sensitivity by over 20%. That means your cells become resistant to insulin in just one night. If you are chronically sleep deprived, you are essentially living in a state of constant insulin resistance. Regardless of what you eat, your blood pressure goes up, your inflammation goes up, your heart works harder. It is a vicious cycle that feeds on itself. Poor sleep leads to high insulin. High insulin leads to poor sleep. And your heart is caught right in the middle. But remember, this is only the first warning sign. The second one is even more dangerous because it happens right after you eat. Number 2 is the crash after meals. If you feel tired, foggy, or completely drained after lunch or dinner, that is not normal. That is your blood sugar spiking and then crashing. When you eat a meal high in refined carbohydrates, like white bread, white rice, or sugary foods, your blood sugar shoots up fast. Your pancreas releases a massive amount of insulin to bring it down, and then it drops too fast. That drop leaves you feeling exhausted, irritable, and craving more sugar. It is a roller coaster that your heart is riding every single day. Every time your blood sugar spikes, your blood vessels stiffen. Every time your insulin surges, your arteries become more inflamed. And you think it is just a food coma. You think it is just a heavy meal. But your body is telling you that it cannot handle the fuel you are giving it. And the third warning sign is the one that most men completely dismiss. It is the belly that will not go away no matter how much you exercise. Number 3 is stubborn belly fat. And this is where the thin on the outside, fat on the inside phenomenon comes in. The fat that wraps around your liver, your pancreas, and your heart is called visceral fat. This is the most dangerous kind of fat because it is not just sitting there. It is active. It releases inflammatory chemicals that make your cells even more resistant to insulin. It literally poisons your system. You can be lean everywhere else and still have dangerous levels of visceral fat. And this fat is directly linked to heart disease because it is wrapped around your heart. If you have a stubborn belly that you cannot lose, especially if you are over 50, that is your body screaming at you. It is not about vanity. It is about survival. Now here is where the real shock comes in. This is the part that most doctors do not tell you. And it is the reason I am making this video. The standard blood sugar test that your doctor runs at your yearly physical is missing the boat. It is looking at the wrong number. The standard fasting glucose test measures your blood sugar after you have not eaten for 8 to 12 hours. It is a good test, but it is often the last marker to go bad. Your pancreas works so hard to keep your fasting sugar normal that this test can stay normal for years while your insulin AC levels are through the roof. It is like watching a car engine overheat and only looking at the speedometer while ignoring the temperature gauge. You are looking at the wrong gauge. The number you need to ask for is your fasting insulin level. This test reveals what is going on behind the curtain. If your insulin is elevated while your fasting glucose is still normal, you have caught the problem early. That is the golden hour. That is the moment when lifestyle changes can have the most dramatic effect. You also need an A1C test. This measures your average blood sugar over the past 2 to 3 months. A normal A1C is below 5.7. Prediabetes is between 5.7 and 6.4. And diabetes is 6.5 or higher. But remember, even if your A1C is normal, your insulin could still be high. Ask for both tests. Do not leave the clinic without them. And here is the good news. This is where we shift from the scary part to the empowering part. Prediabetes is not a life sentence. It is not a permanent diagnosis. It is a checkpoint. It is your body telling you that the current system is not working and it is time to make a change. And here is the beautiful thing about the human body. When you remove the insult, when you stop putting so much sugar and carbohydrate into the system, your cells start to heal. Your pancreas gets a break. Your blood vessels start to relax. The inflammation drops, and your risk of heart disease drops right along with it. So what do? I'm going to give you the one simple trick that has worked for thousands of my patients. If you do nothing else after watching this video, do this one thing. Eat your protein and vegetables first. Save the carbohydrates for last. That is it. Protein and fiber slow down the absorption of sugar. If you eat your steak and salad before your bread or rice, your blood sugar spike is reduced by up to 50%. One change. No dieting. No counting calories. Just change the order of your food. Try it tomorrow. Your body will thank you. Beyond that, I want you to move after meals. Walk for just 10 or 15 minutes after dinner. Muscle tissue is the biggest consumer of glucose in the body. When you contract a muscle, it pulls sugar out of the bloodstream without even needing insulin. Think of it as a bypass. You are giving your pancreas a break because your muscles are doing the work for it. And finally, prioritize your sleep. I already told you how one bad night of sleep can reduce your insulin sensitivity by over 20%. If you are chronically sleep deprived, you are living in a state of constant insulin resistance. You have to treat sleep like medicine because it is. When you put all of this together, what you are building is a lifestyle that not only prevents prediabetes but actively reverses it. You are slowing down the aging process of your blood vessels. You are protecting your heart. You are keeping your eyes, your kidneys, and your nerves healthy. You are adding years to your life, but more importantly, you are adding life to your years. You are ensuring that the time you have left is spent with energy, clarity, and strength, not in a waiting room. Now, I want you to take a moment and think about your family. Think about your grandchildren. Think about the trips you still want to take and the moments you still want to witness. Prediabetes does not care about your plans. It does not care about your retirement. It will steal those years from you if you let it. But you have a choice. You have a window of opportunity right now, while you are watching this video, to change the trajectory of your health. You are not a victim of your genetics. You are not destined to get diabetes because your father had it. Genetics loads the gun, but lifestyle pulls the trigger, and you have complete control over your lifestyle choices. So here is my challenge to you. For the next 7 days, do 2 things. 1. Eat your protein and vegetables before your carbs. 2. Walk for 10 minutes after dinner. That is it. 7 days. Comment below after 7 days and tell me how you feel. I want to hear your results. I promise you, you will feel the difference. And if you do not, comment and tell me I am wrong. I can take it. Now, here is what I want you to do after this video ends. I want you to call your doctor tomorrow morning. I want you to ask for a fasting insulin test and an A1C test. Do not wait for your next annual physical. Do not wait until you feel sick. Because the reality is, you might never feel sick until it is too late. The heart attack that comes from undiagnosed metabolic disease often has no warning. You do not feel your arteries stiffening. You do not feel your insulin climbing. You feel fine and then you are on the floor. That is the tragedy I see far too often. And it is the tragedy I am trying to prevent with this conversation. You have just taken a crucial step in understanding the silent threat of prediabetes. But there is so much more to discover about protecting your heart and your health as you age. If you found this valuable, please give this video a thumbs up. Subscribe to the channel and turn on the notification bell so you do not miss the next one. I want to hear from you in the comments. Have you ever had a routine test that surprised you? Or do you have a question about your insulin levels that I can help answer? I read every single comment, and if you want to dive deeper into reversing insulin resistance, I have a video right here that explains exactly how to lower your blood sugar naturally in just a few weeks. Click it right now. Your health deserves your attention. Thank you for watching, and I will see you in the next one.